All right. Good day. Good day. Please clear your desk of anything that has nothing to do with GNP 1, 2, 3, please. Everything should be suspended. So far this course is concerned, they will constitute distraction for you. Please clear every other thing from your desk so you can focus. You're welcome to our today's lecture on introductory pharmacology, GMP 1, 2, 3. In our last lectures, we saw questions on dilutions, and we moved over to the dosage calculation. We did pediatric dosage. Pediatric dosage calculation. There I give you 3 formulas, right? Yes. Name them. Young, right? Good. And you have used them to solve 1 or 2 questions. Which of them you use when you are giving only the age of the child alone and the adult dose? Which of them do you use? Young. So which one did you use when you are giving the weight? Classroom. So which one do you use when you are giving the body surface area? The BSF formula. Good. Now, today we are supposed to enter the rules of our drug administration. In our usual, we talk about what it means and do our presentation. But there's a question here that I want to solve to clear refresh our memory on what we did the last calculation we did, and for the benefit of those that we are not here. So I would like Blessing to do justice to that. Okay, continue. You said you have what?
You are asked to
okay.
Normal saline 1 liter to drug for 10 hours. How many drugs are you going to set the IV like per minute if drug factor is 25?
25, okay. Okay.
So, using the formula for this, okay, let's just start with drug rate. The formula for this is ml, that's milliliter, over minute.
Per minute. Okay.
Now for drip factor, the formula is drug per milliliter.
Okay.
But this drip factor now, they've already solved it and told us that the drip factor is 25. So no need for this one. Okay. So in conclusion, now if you want to get the drip factor, sorry, the drip rate, it will be drip rate times drip factor. That's milliliter over minute times this dx. That's just a milliliter. So it will be milliliter, that's 100 ml. I mean 1,000 ml. All over. The minute is 10 hours. No, the hour is 10 hours. Just to convert it to minutes. That's 10 times 10 times 60 to be 600.
600 minutes, okay?
Times the dx. The dx is 25.
What's the answer? Put INS so that we know that it's minutes. It looks like 600 meters. Put INS, good. So what's the answer? So how many drops? Make it a whole number. How many drops? So for 2 drops, right? Is it? All right. Conclude your calculation.
So the drip rate now.
Is it drip rate you are calculating?
No, the number of
drops.
Okay. Per minute.
Yeah. So we have. Okay, continue.
Yeah. 42 drops
per minute. So are you aware that by this question I'm asking you how many drops per minute? they are indirectly asking you the drip rate. Are you aware? By asking you how many drops per what? Look at the question. You are asked to set normal saline, 1 liter, to drop for 10 hours. How many drops are you going to set the IV line per minute? If the drop factor is what? 25. So they are indirectly asking you to just calculate the what? Drip what? Rate. Are you aware? Are you aware that if you give this thing, the answer is 42 drops per what? Minute, which is certain as saying what? Calculate the what? Drip what? Rate. Now, those that were not in this class, this thing will look like as if you are speaking Chenkongo. I understand, but sorry, we cannot do what? Go back, because we cannot be going like piece of paper thrown in the air, to and fro. You can't be going like that, okay? Maybe if we are through with these things before your exam, we can go back and do what? Revision, but you cannot be going back again. Just meet others to do what? Put you through. I'm sorry about that. We have time, we work with time. Now, this is definitely saying what? Drip what? Rate. Simple. Now, I like how she started. She said, this means that she understood what we did last week. She said, is it last week or last 2 weeks? She said that the drip rate is the volume per watt. In this regard, actually it should be the amount that enters per watt minute. But I say that sometimes the amount may be in terms of the milligram or in terms of the volume, right? In this case, now they are looking for it in terms of the what? Volume, which is a male. Male that enters per what? Minute. It took to do what? Enter. Gives you the what? The drip what? Rate. Here now is the word. You can call this drip factor. You can also call this what? Drop factor. Some literature call it drop factor. Some call it drip factor. But I'm talking about the same thing. It's just the number of drops per male. And I told you that this is this drip factor is a property of the what? The tube we are doing what? Using. Did anyone want to bring the drip set? Let me see it. Let's confirm what we did last. I told you, let's confirm. Did you confirm it or did you check it? Is it there? Perfect. You now appreciate what you do, right? Good. That's why we look at all those things. It helps us to appreciate what you are doing. You see now, drip factor here now is, they say that 1 drop is 0.05 ml. So what is the drip factor? From what you can see here, that 1 drop contains 0.05 ml of or whatever you are using it to do what? Infuse. What is the drip factor? Here, they say that 1 ml is 20 drops. Or simply, 1 drop is 0.05 ml. What is the drip factor of this? 20 what? You have not answered the question. You are telling me the number of drops. Is the number of drops the drip factor? So what is the drip factor? Or the drop factor? You are told that 1 ml contains 20 drops. So what is the drop factor? Bless Noya. What is the drop factor of this infusion? Of this IV given set? It's written now on the packet that 1 ml is equal to 20 drops. So what is the drop factor? So what is the drop factor? So what is the drop factor? So what is the drop factor for this IV given set? 1 ml is equal to 20 drops. So what is the drop factor? You don't need calculator. You know that 1 ml is equal to 20 drops. So what is the drop factor of this IV given set? So what is the drop factor? Huh? No. What is this formula for the drop factor? Huh? And as soon as again, 1 ml is equal to 20 drops. So what is the drop factor of this? 20 what? Now whatever it is, can they mucha akamu na akara wala na tufa. It's not 20 drops per what meal. It's simple thing. That is drop factor, yes. See, they just told you that 1 meal is equal to 20 drops. The drop factor here is now equal to what? 20 drops per meal. And if you convert it again, it becomes that 1 drop will now become 0.05 mil. It's not true. So if 1 drop is 0.05 mil, drop factor is 1 drop over 0.05 mil, which is what? 20 drops over per mil. It's not true. Because 1 drop divided by 0.05 mil is 20 drops per what? Mil. So the drop factor is what? 20 drops per mil. This is nothing they calculate. Here we just, how are you? Here we just, twisting of the whole thing. But actually, maybe they just did it in such a way that they wrote it in such a way that somewhere that anybody can understand it. But if they want to write it the right way, it should be DF is equal to what? 20 drops per what? Mil. Period. But it's okay. It's not bad. So I just want you to understand, because you don't know the one you will see tomorrow. DF of this is what? 20 drops per mil, because 1 mil contains 20 drops. You find 20 drops in 1. That's the meaning. You find 20 drops in 1. That's the meaning. Therefore, 1 mil contains what? So if you find 20 drops in 1 mil, therefore 1 mil contains what? 20 drops. So if you now want to find how many mil that will contain in how many mil that can contain 1 drop, it becomes how many? 0.05. 1 divided by 20. It's not true. 0.105. This is just simple calculation. So thank you very much for this. Do you now appreciate that?
Yeah. Also, the reason why so will not be different drip lines.
Drip what?
Did you say each drip can have their different?
Drip factor now?
Is there anyone that is greater than this one?
Yes now. I told you that different IVs have their own drip factor. The one they can deliver. How many drops that have delivered? How many drops that can come out from here? Each male. They are not the same thing. They differ. There are some you see. Some may be 50 drops per male. Some may be 25 drops per. But I can't get it. 20 drops per male.
So is it that the 20 drops will be in this size?
1 mil that comes out of this contains 20 drops. 20 drops. In this, that's why they wrote it for this particular one now. 1 mil is 20. It's equal to what? 20 what? Drops. For this one now. Did any person get? As he said, only one person was able to get. Okay, the same one.
Is the 1 mil? Is it in this container? 1 mil, or in bite?
I said the tube. It's tube, not.
Okay.
It's tube. Yeah.
Okay, that should be 1 mil.
It's tube is 1 mil. I think I understand his question. If you use this thing now, if you set it, use this particular tube now. What it means is that 1 mil of anything, like 1 mil of what drop from 1 mil of whatever comes out of this contains 20 what drops. It's equivalent to what 20 what drops. That's the meaning. So if you are using it now to set line now, and you set time, and the initially what was here, maybe it was initially here. Now you have maybe perhaps now 50 mil, and the thing come down to 25 mil. You have delivered 25 ml has entered the system, right? But number of drops that can give that 25 ml is 20 drops times 25, which is how many? 500 what? Drops. That's the meaning. Now, if you want to break it down to what? Number of drops that entered. Since 1 ml is 20 drops, if 25 ml enters the body, that means the number of drops that enter is what? 500 what? Drops. That's what they want you to know here. Let's say that the drop factor here is what? This should have a unit. Note please. This should be what? GPPS per what? Ml. Are we together? So if that is the case now, since we now know that you are asked to set normal saline 1 liter to drop for 10 hours, how many drops are you going to set the IV line per minute if the drop factor is what? To 25 drops per what? Ml. Now the drop factor is what? Ml per what? Volume per what? So drip rate is what? Milliliter per what? Minute. Now, but here we are told that the drop factor is equal to what? Volume per what? Ml. We are asked to find the what? The drop factor. Now this is the drops, right? Is it a measure of volume? Drop, is it a measure of volume? Yes. Drop is a measure of what? Volume. But it's not a metric what? System. It's avoirdupois system, O system. It's not a metric what? System. Now, but we have here drops per what? What it means is this, that what this means that 25 drops is found in what? 1 ml. Is it clear? That 25 drops is found in what? 1 ml. Now, if 25 drops is found in 1 ml, remember we are told we are giving what? 1,000 ml. True of us. Since we are giving 1,000 what? Ml, and we are told that there are 25 drops in 1 ml. So how many drops will be in 1,000 ml? If there are 25 drops in 1 ml, as we claim, the normal size, remember all these things will enter the system. Hope you know. The 1,000 ml will enter the what? System, right? Good. Now we now ask, the question is now how many drops can we find in 1,000 ml? You just simply do 1,000 ml times what? It will give you what? So we have 25,000 drops in 1,000 ml, right? So you now bring that to 25,000 drops and put it here. Are we together? It becomes 25,000 what? Which is what she did. Remember? That's what she did here. But this will give you the same 25,000 drops, right? Now, 25,000 drops divided by what? The what is it again? See where we are working with. Hope you know. So this is now 25,000 divided by, but the time should be in what? Minutes, not in what? Hours. We are giving in hours. So we convert this 10 hours to what? Minutes. On here again, 600 what? Minutes. We bring it down. We divide this thing, and we get what? 42 drops per minute. See, let me now tell you the implication. You can adjust drip rates of IV giving set. You can add all the drip rates here and adjust. That's why they want you to adjust it to be having 1 drop, to be having 42. If you want this entire 1,000 ml to finish under 10 hours, you adjust it to be dropping 42 drops per minute. You can adjust the rate to be dropping at the rate of 42 drops per minute because you want it to finish in 10 hours. When you see your prescription, the doctor will just tell you to deliver this entire 500 ml in 6 hours. You will not see any other thing again. True of us. Have you seen prescription before? You will see that the set line that 500 ml to be delivered in 10 hours. That's what you see, or 5 hours. That's what you do. What see? Go and call this guy. Aim at the drip factor of this IV set. Then aim at the drip factor of the IV set. You calculate how many drops that can be delivered per minute. You must know what how many drops you can set it so that within 10 hours it will finish. Now, if you are not asked, let me now tweak this question. Set this line so that you can finish 1,000 ml in 5 hours. What will you now do? Just simple thing. You don't need to punch your calculator. If you want to change, if you want to set this in now so that the entire 1,000 ml will finish in what? 5 hours. Now let me ask a question. If you set this IV set so that the 1,000 ml will finish in 5 hours, and set it so that it will finish in 10 hours, which one will be faster? 5 hours is faster, right? Yeah. So if it delivers, for you to achieve 10 hours, you deliver 42 drops per minute. How many drops will you set it to finish in 5 hours?
You divide it. 21. It will be 84. 84.
Because each oka, you have under omi boy, yeah. Open is settled 42 drops per minute. We finish here in 10 hours. Each talk will finish in 5 hours. It's set here to be 82 drops per minute. It's 84 per minute. So this is, you can adjust the drip rate. So for all this drip you use, the factor is the factor. You can't change it. If you want to change the factor, look for under what? But you can be adjusting the drip rate so that you can free the time you want it to do what? Finish. Depending on what the doctor wants to achieve. There are some that they want them to be on bed rest for like 24 hours. Aquanelia, what we drop for 24 hours. Can you go anywhere any reason to get up? Okunyasi and one, so if you now let me ask you, if you now want to set this thing, if you want to set it, even though it may not be applicable physically, but let me just assume you want to set it this 1,000 ml to finish in 24 hours. How will you set it? Let me know those that think. On your desire under 1 minute on 1 RC. Time is going. On your desire 1 minute on 1 RC. Time is going. What's the answer? Then aboard. Then right on the board. Time is going. Give me the answer. Just write the answer. Then what do you calculation, man? Write the answer there. $17 drops a minute. So another person, 1 minute is about to go. 17 point what? Huh? Is that what? What is it? $17 per word. So who got it? But both funny is that you understood what you are talking about, right? Good. So let's see whether you got it now. We know that using this one, right? So for it to deliver under what? 24 hours, right? So we simply do what? Multiply the 24 hours by what? 60, right? And we get what? At the end we get what? Divide this. You go to 4,000 by 1,444. What's the answer? So you can just simply say, I will say, let me say 17 drops. Are we together? So that means a minute. You get set here. But you may almost finish under 1 hour, or almost finish under it will make it 18 drops. Hello? You may 17. You may have some fractions. Before 24 hours, that fraction will bring down the time with more than 24 hours. So if you want to achieve it within 24 hours, so you should be what? 18 what? Drops per what? Per what? Minutes. Higher, so that's 23 hours point something.
Okay, if you were to make it 17 drops per minute.
It was in discipline.
Like if it takes that, are you going to go down one
You do the setting here. You do the setting what? Here. But you must have like you set your own here. Within 24 hours, it will finish. Okay. Okay, tell about next year. Or doing the setting up. Let me understand what you mean. Who has set the line here? Even though, yes, I know. We know. Get it together, yeah, by jumper. Yeah. Hello? The time that you don't need to stay there and watching it for that 6 hours, 8 hours. Once you have done your calculation, you have to let it run. Remember, here and we screw, here and we can here. You see that pink this thing there? So you watch here, goes to a drop, bam, 18. Okay, at a point, you may leave it, you may set one first. See how many drops you can deliver within. So as you able to get the one that will drop at that 18 drops per minute, you leave it at that level. That's how it will drop in. Remember here with school, that thing is natural. As you school at that point, this is how it will drop in per minute. Am I complicated? So how you fix it will tell you the number of drops it will deliver per what minute. Hello?
Sir, what if the patient sometimes leave to eat his or herself? How will you return everything? Like when the patient leaves, I'll come back again. If you put the thing back, will you start from where it stopped?
So have you ever encountered a patient that after certain line, or so how do you do it? Okay. Yes. Okay. Mm-hmm. So how do you now maintain that time? Will maintain the timing? Why do you check it again? Why do you think why do you think it will still maintain the time? A very big question now. Why do you think it will still maintain that rate? That's a very big question. The more education, the more questions are coming out. How do you think? Why do you think you should maintain that? If that thing, if that thing you clip, watch it. Do you touch it? Do you touch it? You don't touch it. Hello. Okwu apụtarago. Okwu na-apụta n'ike na. A na-ebu ya ja anyị ọkụ ya. Under option. Then you put the ring in the charging. Okay. But as you go in there, is he entering?
Yes, that's going to enter. If you come back, then I will use your then you start. No.
Someone asked, the question is this. The very important question is this. Hello? Hello? Except if I'm lying on one man. About my area. I've never set a line before. Hello? I've never encountered a situation that made me to go and set what? Line. And I cannot just wake up and go and start setting line. I'm not getting here. I've never encountered such situation that forced me to. Like now, the injection I gave was situation called for it. Hello? We'll learn it. We should know that this is how you do it. But that I injected what that situation occurred, and I have no choice than to do what? Do it. And I did it perfectly because I have learned it. Hello? Nobody will carry you as a pharmacist, take it to ward. It is not. It is not done anywhere. Maybe you are opportune to work with a nurse, or maybe now your mother is a nurse. If you go see a mere, just practice it if you go now. But to know it theoretically, you know it theoretically. In case emergency, you never can tell. Hello, but for me to go and start setting, I have never done it before because I have not been in a situation whereby I will be forced to do it. But I know the theoretical background. If emergency that you must nobody to do it here, I must do it too. Hello? Yeah, I would not a situation now. Somebody will do what? Die. I must do it too. To save life first. Maybe that there was any choice. But not for me to go and start looking for who to set line for. I blow my work. It's not at all. But I know that as you asking the question now, you are the one to adjust the rate. Hello? You are the one to adjust rate. Have you not seen that as we are teaching this thing, I'm watching her. She has been nodding her head. She's linking what we are saying with what she has been doing. And she's beginning to appreciate it well, right? You don't know the meaning of what you are doing all this while. That's the beauty of this lecture. You may you don't know what you are doing. I go know mail trap. What do you mean? You know why you are doing it. But now that we have discussed this in class, you begin to appreciate it. Okay, is that why we have been doing that since? Okay, now you know you can do the calculation now by yourself now. Where did you before? So that's the beauty of what you are doing. Hello? And no one maybe assist because of whatever, but I'm not in business without that thing. And it's for now, until one situation. But I don't pray for such situation. I don't pray for it to happen. I don't pray for it to happen. When it wants to happen, let it happen when a nurse is around, a medical doctor is around, not when only me is around. But when it occurs, a bullion is Megan, as no Megan. All right, now let's continue. So any other information you want to get, you can now work with a net and see exactly what they do. Now that you know the theoretical background, what it is, you will now appreciate it well. In case you see yourself tomorrow, see somebody doing it. Maybe if you have never tried it before and you see somebody doing it, you can understand better why they are doing what they are doing. But what they won't tell you what they are doing. They may be doing the calculation, but you will know what they are doing. Hello? So this is what it's all about. I think we have dwelled so much on this, right? I think we should move. Well, don't you think so? Yeah. We should move. We move. Let's listen to what we have you submitted my assignment. Let me have the assignment, please. Okay, what I say in the last class? As I step in here, I must do what? Collect some. The one you collected, let me see. So we said today, what do we say we are entering today? We have not done anything. We have not done any presentation on the roots of drug administration, right? Have we done any presentation on roots of drug administration? Have we done any presentation on Roots of drug administration. This one people are looking at me as if you don't know what I'm talking about. Who has done it here? Who? Bring it, let me see. Back. Where is it now? She's looking confused. Where is it now? Bring it and let me see. It's not here. The ones there, nobody has done it.
Drug constitution and processes. Yeah, the 20 people.
Okay, I didn't give you assignment on roots of drug administration.
No.
Is it in your outline?
No.
Okay. With the Asian, it's not men like I'm confusing. Let me see on me. Let me see again. All of it be how do you ever now? Those are just roots. Oh yeah. Okay, if I didn't mention it, it may be. I thought I mentioned it here. I mentioned it right. I thought she was coming up as a witness for me. So what did it do there? To have here. I think we have. Let me see if we have done everything here. On what? Come and elaborate for us. Also. Yeah. I'm with you. Continue.
So these ones now, and we submitted our assignment then. So these ones are the three things that are supposed to continue with this presentation.
Okay. I think I begin to understand what happened. You know, it has been long we did this. This calculation took our time because I noticed that some of you we are lacking in calculation. So I tried to handle it, and that is what we've been doing since. I just believe that the time we spent on this thing worth it. Not when I give you question now in never answering. I hope nobody will look at the thing that day.
Yes.
Because I know we spent time. On this calculation. We spent time. And I gave you the opportunity to bring as many questions as you can. Okay, you want quiz? Immediately exactly will come that quiz. Oh, you say you want quiz now? No. You don't want quiz again? No, we want quiz. If your timetable comes out today, the next class we're going to have a quiz.
Yes, sir.
Are you okay like that?
Yes, sir.
The next class following it is quiz. Is that what?
In your marking scheme that you are posting on group, you said our assignment, our presentation, quiz, will make up to 30 minutes.
I said so.
And so we have to have that.
You have to have it now. Quiz you must have. But it's good now. It's good now. Okay, so give me a piece of paper, please. Bring it now. Okay, I should come and take it. Are we together? Please, let me say one or two things here. See, in this principle of drug administration, one thing you need to understand is that we talked about drugs, right? We talked about dosage forms, right? Did I talk about dosage form in your class? Difference between drug and medicine, drug product, dosage form, right? Good. And here, before you a lot of, in fact, the principles that underlying any route of administration is that you talk about the different rights, right? Different rights involved, different what? Rights. Not just that. You also talk about. You go deep a bit. A major determinant is the what? The roots you are using, right? That's a very important determinant. The roots of the what? Administration. So we have a general principle first. We'll talk about it. I'll give you just number 2 minutes or 3 minutes. Talk about. Then after that, I will go deep into the roots of drug administration. The different types we have, ranging from the entera, parentera, and different types we have under each of them. Under entera, we have different roots under entera. When you hear entera, just talk about what enters through the what? Mouth. Hello? Then parentera, what enters through means that is not what? The mouth. Specifically, the hair good. We talk about different types of what? Parentera. But before that, I want you to talk, you say we start at number what? 3, right? So we start from number what? 4. Can I be a man to board that day now I'm up on a board that made me to go into the calculation? There was somebody that went to the board. Maybe they killed oh. What are you saying after this? Go up, yeah? You should clap for her because she was the one that led us to all this long journey. You know? Because that day she exposed a lot of things. You know, in fact, that made me try even to go down to primary school level to start teaching what? Calculation, because I noticed that there were a lot of loopholes. I thought it's just normal calculation that you should know all those things. And I realized that there are a lot of things to be done. That's why I say you should clap for her. And then I had whatever she did that day took us for the past 1 month of year. But I believe that you've learned a lot there, right? Now, I think we'll start from her. Come. Can you present to that day? Okay, we do that day. We don't do that day. What present?
You know, we're doing
I don't think I scored you. I didn't score you because I scored you. Okay, no, okay, but not based on the calculation. Didn't present another that they are apart from the calculation. I didn't score you. How do you say this? This is 4. Where are you? Come on, this is 4 fast. Yeah, what's the number? Okay. Kedia. Come on. What I've been able to do, we don't to do the assignment I failed to do. But have you submitted this? Use the one you did. Wait, so this is sure using your nose. I have use ever. Okay, you want a guide? Okay, come on, use the assignment as a guide. Fast. I want to talk about what time. I came here. When did I come in here? What time now? So I want to see. I want to touch the roots of the blood and change before I go. Oh yeah, fast. Start from the principles of drug. Start from the principles of drug administration. We have 2 minutes to do that. Fast. The time is going. Okay, tell us. what we need to know about rules and principles of drug administration. Okay. Please, let's listen to her, please. Please, project your voice, please.
The three basic principles of drug administration, which are right of patient, medication order. Medication order, this is an order which prescribes specific medications which are to be administered to a patient with specific dose. Example, standing order. Order to be followed and to be cancelled by another order. PRN order, task order, part of medication order, which are patient's name, date and time, name of drugs to be administered, dosage of drugs, route of drug administration, frequency of drug administration, signature of person writing order. The rights of a patient are there are 11 rights of drug administration, which are right medicine, right patient, right dose, right route, right time, right reason, right documentation, right education, right assessment, right evaluation, and right to refusal. We have three checks before giving. The medication label should be checked 3 times before giving medication. That is after taking medication from shelf, before putting into the container and before putting it back in the shelf. Then, in that case, we should mention 2 specific drugs used in Nigeria, which are tramadol and gentamicin.
All right, thank you. Even though that is specifically the work of pharmacists to dispense drug, but sometimes you don't know where it's headed tomorrow. If you want to give the drug, maybe even if you want to administer drug, right? You go to the shelf, right? Check what is in the shelf. Be sure of what you are looking at in the shelf. Then if you pick it, after taking the drugs, the medicine out from the whatever packet or whatever, check it again, right? Or what you are doing, what you want to package, right? For the patient. Then after giving the drug, you have to package it, and before taking the patient, you have to check back again. That thing you drop back, whether is what you intend to do what. Am I completing? 3 checks, right? Good. And she mentioned 11 rights. All right, thank you very much. Thank you. Thank you. Thank you. Drop it there. Zero. Someone should help me with pen. Thank you. All right, 00 what? 00 again. Kerebono. Oh yeah, come out. Yeah. Take our microphone.
Good afternoon, my fellow students. Should I start from the principal?
Yes. What is
the principles of drug administration.
Okay.
We have the right patient, the right drug,
Okay.
the right route, the right dose.
Right what?
Dose.
Start at the beginning. Say the principle of what?
The principles of drug administration.
What? Right what?
The right patient, the right drug, the right dose,
the right time and the right route. Now, the right patient. This means that the patient being treated should be correct. In fact, the correct recipient for whom medication was prescribed. So whoever that you are giving medication should make sure that the person is the main person that the drug is prescribed. Another right drug. So that ensuring that the medication to be administered is identical to the drug name that was prescribed. So under this right drug now, you will be very, very sure that you don't make mistakes, that the right drug that was prescribed by the pharmacist is correct, is the same thing with the that was prescribed by a physician. Is the same thing that you are administering to the right patient. Now, to the right route. Medications can be given to patients in many different ways or sites, all of which vary in the time it takes to absorb the chemical. So, different drugs have their own routes of administration. Some are topical administration, IV, IM, so many routes of administration, and it varies to the time which it will take for the chemical to absorb. Now come to the right time. The right time, administering medications at a time that was intended by the prescriber. Often, certain drugs have specific interval or window period during which another dose should be given to maintain the therapeutic effect. Yes, many drugs have their own interval, like when you should take it, the interval before you take it again. Like example, like sulfur, diazine, prometamine. So they have their own. Sulfur, diazine, prometamine. Is preventive. Sulfur, diazine, prometamine.
Is this sulfur diazine? What is the common brand name?
Malaton.
Is this sulfur diazine or sulfur?
Okay.
And what?
Okay. So they have their time interval that you need to maintain. For the therapeutic effect. Now, right dose. Now, the right dose. Any drug has there.
In my mic. Hello. Please, I sent a link on the WhatsApp group. There's a link I sent there. A link of is a published material on drug administration. Are we together? Hello. You need to learn how to do research, not just to sit down and be copying notes and be cramming notes. There is a link I dropped there. Make our time. Go through. Open the link. Go through the information there. Is detailed. A lot of things you need to, about what drug administration. The roots of drug what administration. If it categorizes it into enteral and what parenteral, then under enteral you start seeing a lot under parenteral. Then under enteral you see. I want you to go through it. Make note from it. Are we together? Just digest it. Make note from it. It will help you. So that's what I want you to do at your free time. Next person, 006. 006 what? Come out, 006, come out. Okay, see, never mind, thank you. Mike, did you too? Yeah. After another mic, you too.
Okay.
I want to know, see what people do. Just start on your own yourself. You are this is 5 what?
Yes.
5 what is
6. Parts of medication orders include patient's name. Eh?
Is that what we get today?
Yes.
In your work?
Okay, from the beginning.
Yes, from the beginning.
Drug reconstitution.
You are talking about what? Principles of what?
Principles of drug administration. There are 3 basic principles of drug administration. Medication orders, right of the patient, check through it before giving. Medication order is an order of which prescribes specific medication, which has to be administered to a patient with specific dose. Number 1, standing order. Orders to be followed until cancelled by another order. When you make use of your standing order, you follow the instructions given to your standing order. PRN number as needed. Start order. Immediately carried out. Part of medication order includes patient's name. Date and time order is written. Name of drug to be administered. Dosage of drug. Route of drug administration. Frequency of drug administration. Signature of the person writing order. Medication order. Patient's name should be there. Date and time of the patient should be there. Then the name of the drug. The name of the drug to be administered. Dosage of the drug. Frequency. And the drug is supposed to be expired. Rights of patients. There are 11 rights of drug. Right medicine. You have to give right medicine to the right patient. Right dose. Right route. You give each drug to a patient at the right time with a specific reason, right documentation. You document on how the drug is given to the patient. Right education, right to refusal, right evaluation, right assessment. You educate the patient when you administer drugs to the patient. 3 checks. This medication should be checked 3 times before giving in medication. Before you take medication from the shelf, you have to check it 3 times. Before putting it into the container, you have to check it 3 times. Before placing it back in the shelf, you check the medication 3 times. Major determinant is the route of the drug. Specific drugs to be given. Example: ceftriaxone, genetotin, diclofenac.
Okay, come on, one mind. Okay. What do you normally take here? I'm seeing people want to go there. What do you here for? Captain, what is that? Key for what? Okay. It's allowed. Okay, now, 007, I'm going to come out. Zero, you can go carry him. Come on. Oh yeah, that's the page. That's the CR. Just one there, I'm going. And okay, okay, I understand. It's allowed. Your name is what? Sorry. All right. Pass. Take mine. I tell mine. Oh, yeah.
Sir, should I start?
Yes. Start.
Good day, my fellow students.
Good day.
The basic principles of drug administration are in place to keep the patient safe.
I agree with you.
Those steps are usually taken by a nurse.
Okay.
And the number in the process of administering medication.
Okay.
Wash hands, put on gloves, and get any prescribed medication. Wash hands, put on gloves, and get any supply necessary to give medication via the prescribed route. The administration of medication is an essential aspect of nursing care. Safe practice is essential, and the nurse must be aware of their professional and legal responsibilities in relation to all aspects of medication management, in relationship to children and young people. Nursing practice. The nurse also needs to consider the child's development stage, the ability to consist to treatment, and the role of parents to care. The correct equipment should be collected. The nurse should check the prescription of date, time, frequency, dose, additional information, and signature as part of the internal preparation process. The nurse should be able to demonstrate an understanding of the plan of the treatment for the child. 5 routes of safe drug administration: right drug, right dose, right patient, right route, and right frequency.
No.
Yes, sir.
Thank you. How can you speak without mic? Is it possible? Oh yeah, take mic.
Okay, sorry. Good day, class. Good day, master. So, I'm here to talk about the definition of drug reconstitution. Okay, so principles of drug administration. We have the right medication. We have the right patient. We have the right dose. We have the right time to give that medication. We have the right route of administration. We have IV, IM, oral, and so on and so forth. We have the right reason of giving that drug to the patient. So we have the right documentation. So we have we have the process of the constitution. In the constitution, you will take the constitution simple means is the process of adding a solvent to a medication in powdered form to dissolve it and form a solution. So in this constitution processes, you will take the expiring date, the type of solvent to use, whether sterile water, normal saline, 5% dextro. Never assume the type of amount to dilute the water. Don't assume. You will read the label. You understand? To follow the guidelines given to you in that rubber, in that bottle.
Which rubber?
In the drug or label. You understand what I'm saying?
I don't understand what I'm saying.
In the drug given to you, you will read the label.
So you say rubber. So I'm trying to understand where rubber came from.
Drug given to you. You will what? Less amount of dilute solvent to be used. Where to store the drug when mixed. If no direction are provided, use what? Length of time medication is good once mixed, like hours, days, and weeks. So, I'm done. Make sure you check the expiring date too. Do not give a patient expired drugs. And store in a refrigerator and take away from sun.
Please, in case I don't know if I've mentioned it in this class. If you must do well in my course, you and the other tagaboko. You and your data gabako. See what I mean? What I mean by nungabako means that you don't waste your words data. So if you are the type that waste your data before, conserve your words data because you have a lot to. Sometimes I'll be dropping links. Hello, you ask you to do what? Look it up. Get the information I want you to use it for. Hello, are we together? So please, try as much as possible to, if you've been putting your data, wasting your data on some, not that they are not important to, but at least, provided that you are here as a student, use it what? Wisely. That's what I'm making. But what I was sending doesn't require MB, just kilobytes. They are just documents you can just access it what? Kilobytes. So you don't even need gig or MB to access them. Hello? So please, try as much as possible to make sure you have it, because as I send, you look at it, study it, make your whatever you want to make out of it. If I come to class, you also do what? Make it up. If you do your assignment, you also do what? Make it up. Before what's going on, before what's going on, provided you are following what we are doing here, step by step, you'll be amazed when you look back and open your notes. You'll be like, what did you do all this? When and how? And because you are following what you are doing, by the time you open your and that's your notes again, you feel that you know almost everything there. Not that you sit down and we are coming and be dictating one note. After dictating, you cram and go and some not even know what they are cramming. But it's true. So please try as much as possible to follow as we move. Next person. You are 0 what again? Take one. Any question? All right, ask sister.
This link in a post right now. So,
anyone the other one, anyone that has business to do with what you are doing as that you should look at. I'll let you know. Judge that today now. I posted something today now. Just a link. It's not a video link. It's just a document. Not just now. Yeah. Thank you for that. It seems that I'll stop posting things there. Thank you. I think you have brought my mind to something. You can confuse people. I'll stop posting things there. Hello? I'll stop posting things there. I think I have a general group where if sometimes you carry your phone, once you play them, you start sending them out. Sometimes you don't even know where it's entering. He says I'll stop posting things there. There are many other groups I post things there. So maybe to avoid confusing people, I'll stop posting things there. So from there onwards, I'll not anything you see me post there, I want you to do what? Read it. Hello? Please tell others, please. I think I posted a lot of things there. You just know that it's the way you open it that I started seeing video links I was posting there. That's wrong. I'll stop it, please. So from there onward, anything you see me post there, please take it seriously. It concerns you as a class. Hello? I have a general group where I added some of you. Some of you we are running away from it. It's okay. It's not. You mustn't be there. But as for this class own, for it to be carried along, it should be there. I saw some people left. Some people, I don't know why they left. Whether they left because they have so many. Who is so many children? Who is so many children? You left your class group. Why did you leave? And you didn't bother to ask me to add it back. Relax, yeah. And was that important information in the post there? You not get it. I'm going to talk about an issue. If you left the group, it happens. Tell me. There's a group there's a group named Fermenting the Schoolboy. That one is just a lot of people are there. And there's some new. So if you leave that one, I won't bother because you don't want to be there. But for the one that concerns your class, please don't leave. We have a post information that may have to do with the things that I want you to read for your course. You will not be there. So please, if you left the group, please let me know so I can add it back. It's very important, please. I'll stop posting things there. So that you know the one that has a lot to do with. But there are some lectures I recorded here. I posted the links. If you see the topic, you will know. Those ones are videos. If you have that, you can watch them. You can listen to them. They are classwork. Anything you see me post there concerns you as a class. Anything you post there and from today onwards concerns you as a class. Hello? Whether it's a video or not, it concerns you as a what? Class. So you now open the one that your data can help you open. If you cannot open with the data, if you are never open, you go to your neighbor, buy and attach, and listen to what is there. Okay? All right. So please let's continue. Who is next? Zero Guinea. I think after this, I will say one or two things about rules of drug administration. Open the chapter for you so that if you read that material, you will understand it. I will do an overview, say one or two things there. After this one. In our next class, we continue for various stuff. Okay, Mike. You see now, people are not asking for my mic. He's a wonderful Mike.
Good afternoon, my fellow students. Good afternoon. So, principle of drug administration. The three basic principles of drug administration are as follows. Medication order, rights of patients, 3 checks before giving. Under medication order, we have it is an order of which prescribes specific medication which has to be administered to a patient with specific dose. Standing order. Orders are to be followed until cancelled by another order. PRN order, as needed. Task order, immediately carried out. Parts of medication order are patient's name, date and time order is written, name of drug to be administered, dosage of drug, route of drug administration, frequency of drug administration, signature of person writing order. We have rights of patients. There are 11 rights of drug administration. We have right medicine, right patient, right dose, right route, right time, right reason, right documentation, right education, right assessment, right to refusal, and right evaluation. The 3 checks are: the medication label should be checked 3 times before giving medication to a patient. Number 1, after taking medicine from the shelf or counter. 2, before putting into the container. And 3, before placing it back in the shelf. Examples of drugs in Nigerian market: ceftriaxone, gentamicin, diclofenac. Finish. Okay, medication label.
This drug you mentioned, did you go out to check their dosage? Remember that's the reason why I asked you to take 2 drugs. You're supposed to mention their dosage. That's the reason why I asked you to mention 2 drugs in the market. Because the intention is let me know how if you know how their dosage. If you mention two, but I would have landed a lot of
Dosage.
So you mentioned 2 drugs, right? Which have you mentioned?
Ceftriaxone, gentamicin, and diclofenac.
Okay. So yeah, did you take the dosage of any of them? You did not. Okay, who knows the dosage of what's that? Come. You seem to be dosage mistress. Come. Come on, educate us on drug theory. Yeah, Mike.
Standing on existing protocol.
Thank you.
In ceftriaxone, we have 2 distinct reconstitution. That drug is reconstituting drug. We have a sterile water. Then we have this thing, what is called the powdered form, and there is another one called Locaine. Then if you want to use do it intravenously, use that sterile water. Then sterile water, the instruction on the label says 10 ml of that sterile water. Then if you take the 10 ml of that sterile water, then you dilute it with the powdered form. Then after diluting, what will be in that your syringe will be 10 ml. Then the 10 ml will go intravenously on the person's vein.
What do we use lidocaine?
Okay, we use lidocaine if you want to inject it intramuscular. Yes.
So, I think we are gradually mentioning routes of administration now. You see the interway, right? Okay, so it's intertwined, right? You cannot talk of principles of drugs without looking at roots. The roots via which you can do what? I mean, like, you see how she's talking about, she's mentioning IV, IM. So my question is this: why do we not use lidocaine for IV?
Because if that lidocaine enters the vein, the thing will make the vein to be strong.
So what happens?
And there will be no passage of
So what happens?
swelling of it will swell up.
Okay, now, why do you think we use lidocaine at all for iron? Do you know?
For suturing.
Lidocaine is being used for intramuscular injection to prevent pain, because lidocaine is a local anesthesia. So it's being used to anesthetic. So it's being used to prevent pain. So if you have to use that lidocaine for intravenous injection, number 1, if you have to use it, it means you localize that. Yes, let me use the word localize. You localize that vein. That vein cannot be able to produce feel pain or feel signal or sensory impulses. So
And you know our vein now moves directly towards our heart. So you're trying to paralyze our vein.
I'm ahead in this life. No. Don't even think of it. Don't even know what I want. Hello? Let me tell you what you. Hello? Please don't make a mistake. You don't even try it. Can you use sterile water for IM? But the pain will. So in Wakwana, I use therapy. You're looking for what? IV. Of course. I believe you learn all this. But anyway, it's really because you learn all this. So that is that. So now let's look at. I think we'll stop here for presentation. Let me round up and down. Any other question? Okay, ask. Take.
Explain the principle involved in drug administration with specific example of drugs in Nigerian market. Let me repeat. Explain the principle involved in drug administration with specific examples of drugs in Nigerian market. So I was thinking, this question now, what you asked us was that we should use a specific drug as a case study. That's why explaining the principle of drug administration.
Generally, good. You can wait. I'm coming. Put in mind. You can generally say what it's about what principle of what drug administration, which I've listened to you for years. We're talking about it. Now, if you can still go down with it, to talk about what specific example. You can someone brought up what tetraazone, right? Right? We are not done with it, we'll still go there. But I just want to hear you out. Let me see what you've done. But do you have any? Did you do this assignment?
Yes.
When did you submit your?
Last.
Okay. Can you talk to us on that? Can you use 2 drugs to talk to us on that? 2 medicines.
Okay.
All right.
I'll start with principle of administrating diclofenac.
Okay.
Number 1, diclofenac is a drug that is meant to be given intramuscularly. That is not meant for. It's not meant to be given intravenously. So the number 1 principle is the injection must be given intramuscularly. Number 2, while giving the injection, air must be expelled to avoid air embolism. That's during if you want to take the drug from the valve, after everything, you must expel air. Because if there is content of air in that syringe, you are trying to inject air into the person's body, which results to air embolism in the body. Number 3, the procedure for giving the drug should be sterile. That is, you must keep everything sterile and clean. Number 4, this injection should not enter the sciatic muscle or nerve of the leg. That's
sciatic nerve.
Okay.
No muscle.
Yes, the sciatic nerve of the leg. Sciatic nerve now is one of the largest nerve in the body that is found in the from the gluteus region down to the leg. From
In fact, the major nerve that enters the lower leg is open around. The major nerve that enters this thing is from sciatic nerve or other nerves started coming out from. So that is the major nerve that enters. So anything that affects that nerve from here. Alright. Because that is where, in fact, if you study the anatomy very well, you will learn that. In fact, the major thing has to be. Did it come out from the setting has come out directly from the spinal cord? Yeah, I know. This is the anatomy here. Have you done nerves? Never system. So okay, sorry. Maybe I don't know, Sha. I don't know why is it that way. Why is it that way? No. You must cut it short now. This long story is going to then what happens? Okay, what are you going to have with I want to find out how sweet the story is. Maybe Bless will tell me that We have learned to tell me, right? No. Now, but seriously, you're the most useful. Who are there sciatic nerve here? Okay, everyone, right? Everyone, right? Okay. Now, sciatic, S-T-I-A-T-I, start it on your phone now. Sciatic now. Let's see, fast. Sciatic, S-T-I-A-T-I. What I want you to trace is take whether it originated from the spinal cord, the directly. Hope you know, of course, you know the spinal cord now. S-T-I-A-T-I-C. Seriously, I like people that do research because you see, there's nothing I want to know. Hello? There's one secret I want to give you. And the secret is this. You want to get it, I don't know about other class, but for me, you want to get the best of me. Be research oriented. Study, research. Because you may research something, a word you mention will take me into what I didn't plan to talk about. And the more we go into, the more you learn. Hello? Learning these days is not just come and follow for you. If you need to start checking out. So, where is it coming from? Is it coming from spinal cord directly? From where? So, that means it comes from directly from spinal cord, right? And is there a picture that shows where it enters? Yes. Where, okay, describe the cause. Where is it coming from and where did it enter? From spinal cord now. So where? See, where did it enter? Where? That enters where? From there, it enters the lower limb. Now, this lower limb, right? Now, as you can see now, that is the major nerve that supplies all the muscles in your leg. So, it's easy to give it away. Need to wear wire. Ever clean our column. Ever. Most of this story you hear that they took by the time to the hospital. So all the muscles here, we have it. And how do you trace it? You use their cotton wool. Those things you see our nurses doing, they will do cotton wool. First of all, use cotton wool too. Some will say that they are drawing marks on their bottom. They will cotton wool, do like this. After a while cleaning, right? You see them do like this. Okay, yeah? They are dividing the gluteus whatever into 4 cardinal points, right? You see this side you go. You divide that into here. Let's say this is your bum. Like this over here. This is the half bum. Maybe they want to inject here. They will do that over here. Up here? Is here they will inject? Where will they inject? The nerve leaves the spinal cord and travels, right? Does it cross here? No. Where does it enter? Sometimes there can be people before and after because even though I have there are things we call anatomical variation. There can be anatomical variation. Sometimes it can move. We know that normal course is mainly here, right? Sometimes it can move and cut here. But it rarely happens. That's why the target was here mainly. This is upper, outer wall. Upper, outer. So I want to hear the with TV here. on appears what are but mainly they avoid anything here. They face what? Here. Hello, because you are running away from what? Society or nerve. Alright, continue.
So, this injection, that's diclofenac, should not enter the sciatic nerve of the leg. And for you to know that it shouldn't enter the sciatic nerve, once you pierce the body, you withdraw. The essence of that withdrawal is for you to ensure that there is no blood. Because okay, once you get blood, that indicates that the needs to puncture the one of the nerve, which is not supposed to be. Now, the expiry date
Only nerve that blood will come out.
Vein. So, the expiry date too should also be checked. Before you give any injection, you check the expiry date to know if the drug has expired. An expired drug will not be given to the patient. Then, in terms of the dosage now, you will give according to your standing order. That's according to the instructions from your standing order. Remember, you are community health students. We don't do things without consulting our standing orders. So you consult your standing order and follow the dosage then. And not just the standing order, and also the dosage prescribed by the manufacturer. No, manufacturer now. Because recommended by the manufacturer. Because manufacturers, after manufacturing drugs, they write the number of the amount or the dosage. Let me use the word dosage. The dosage required by each weight or age. That's either in weight or in age. So you give drug based on the dosage of the recommendation of the manufacturer. Thank you.
Is that all? Thank you. Can you clap for her, please? Ana m like lecture na lagam. A lot of things will start coming out. Even things I didn't even plan to talk about. Hello, come in. So please, I want you to really make this class an interactive one. The world is in your palm. The world is where? In your palm. So make use of it. Try as much as possible. Now, in fact, we are this lecture. We've treated almost everything. We are just from now to the exam. This is what we'll be doing. A lot of things, bringing in a lot of things. Doing presentation, answering a lot of questions. Both the topics we have done in the past. Keep talking about it. This is what we keep talking about. So you will do what? Write your what exam. So if I have material I can send you, go through it, ask questions, we discuss it. Any confusion you're having, bring it up. We will dismantle it. That's what we do. I want to call us. Okay, Zeka. So please, let's take this thing what? Seriously. If you still see questions in your application, please let me know. Bring it up, please. Any topic we have done, any topic in your this thing, you see question, you see anything, any topic confusing you, bring it up. So by the time we are done with this course, you not just only pass the course. You not only appreciate it. They are in a way they can want to be at the office, whatever. Lot. Ọgbàgbọ́ ṣe sí òtá ìyá ọgbọ̀n gbà kọ̀rọ̀ bóyá kẹ́wé ya kẹ́rẹ́ sí òtá ìyá assignment yẹ kẹ́wé ya okay. Alright, please isokwa na class a Aisha sokwa na yobiko now I sent a second link there. That link contains some material on principles of drug administration and routes of drug. That one is a slide. Just go through it, and we appreciate what you are doing more. Now I want to round up, but before I round up, let me say one or two things on the routes of drug administration. Yeah. Any question? Right. If you watch this slide, this website, you don't just before they started you can download stuff, but now you have to open an account, blah blah blah. So sometimes they ask to pay. What to do is this: if you watch now, if you open the link now, you see, do like this, you see the first page. If you see 1 of 34, if you finish making your notes from here or getting information from here, click like this. Page 2 will come out. You get the information you want to get there. Click like this. It will come out. Once you have network, it will come out. Hello, this is what we're doing for this one. But if I'm able to access it, if I'm able to access, sometimes you even see adverts. They're making their money. If I'm able to access it, I will send you the slide. But if I'm not able to access it, just this is what we're doing. If after the advert, because people pay for adverts, so they after some time they wait for you to view the advert. After that, you click here. You enter the page, the 4th page. This is what you're doing to the last page. It's loaded with information. Okay? Look at it, study it, grab the information. I want to teach you how to study. How to research like blessing. You see, no, seriously, if you are doing what I'll tell you. Jokes apart. I'm not sentimental. If you are doing what I'll tell you. If you're messing up, I'll tell you. This young lady is doing well. I'm seeing someone that will go far. If she continue like this, I'm talking about it's time more in the portrait for today. Hello, see. Hello, I like what I don't want to start calling you. You guys are doing well. It's not easy to do this assignment too. Hello, exactly. You guys are doing, but I want you to do more. And then there's something spectacular. I like people that drive me around. Yes. Hello. Don't allow your lecturers. Are you aware that anybody that enters here to teach is supposed to be loaded? Are you aware? Anyone that enters this class to stand up to teach people is supposed to be what? Loaded. How can you opportunity to stay with someone that is loaded? No. You gotta ask the question. Because the more you ask questions, the more in an attempt to explain certain things, the more you learn what you wouldn't have learned if you didn't ask those questions. You just keep quiet, try to move the lecturer out of Nkojibia. If you are in an attempt to explain, and all those things that have been explained, that will contribute to your residual knowledge. That's when tomorrow you can see yourself standing in front of thousands of people speaking because you are confident of what you are made, the stuff you are made of. And if you channel to your past, you will not have that confidence. And moreover, remember your course is community health. By the time you start engaging yourself in public health issues, you start seeing yourself when they want to get people that will talk on things that have to do with public health. Who would they call? Is he a doctor? No. Is he a nurse? What is a nurse? Oh no! If you know what they are doing, you are there to see the community, ranging from different health talks from one town union, village, whatever, gathering, market square, even in hospital, when they want to give talk on certain things, if you know what you are doing, your training should equip you to even go to the doctors and nurses in hospital to talk things that have to do with community health. Two of us. So even now your course, course indeed. Of course, I don't believe in moderate. What I believe is that the person doesn't want to work on him or her self. Don't I believe that there are people that have supernatural gift, intelligence? I believe in that one. Those people exist. But I don't believe that nobody be it. What I see, only when I see no beauty. What I see in person, only the lazy. Actually, even simple. Now this class, when I see no ya amara akwo, onye na afo, bụ onye the lazy. Actually, it's as simple as that. So when I class and I go added off, onye will be lazy. It's as simple as that. But you know, every person no ya with high IQ, I will accept that one. And then they are there. Man, I give one already. You can have the same score with India negative. Wow. Okay, 1 to 200. I am with high IQ na class. Okay, 1 to 100. Higher than where? That's 9. Which means that you want to work the same level of intelligence can still score that words. But the only difference is this. Obulo number of hours so you go out here good get. Because of natural intelligence we can go 4 hours. You need more than 4 hours. Or not blame you. Natural intelligence you may not be asking people questions. But because of your level of intelligence, you should ask questions. Even they are anyone that's super intelligent, but they ask questions, they socialize, they communicate. If they don't understand, they ask questions, they read, they study. You don't know if you go pull out your level there. Oya can see get A. Oya when super intelligent, we see get A. GPA now 4 points. Maybe I got 4 points. So what I'm talking about? If you know, are there more from they're nothing like it starts from how do you come to class? Do you even come to class in the first place? That's number one. Excuse is not to come to class. Do you come to class? Even if you are in class, are you truly in class? These are factors. If you are in class physically, are you truly there? And my class is so simple that I even allow you to record. So what's your problem? Why won't you score A? Let's assume because of your accumulated truancy in your primary school, there are some things you couldn't learn, even to how to take notes from class. Don't you have phone to record it? And my exam, at least by the time before you are in class, you must. My exam is such that you don't need long story. I've never made a card call. If you are OBJ, give me your option. Simple theory question. So what it means is that if you are in class and you read all the assignments you are asked to do, why won't you score A? You may even say Gawanya and super intelligent because now Oche no balance go. But I go man what you block with na Imo so, they're not like Oya with pass. Oya beat na class Oya the lazy. Unless my own specific problem may distract you, which you should let the school do what? No, simple. Even specific issues, there are some issues you bring to school. School will even advise you. Why not defer your admission? Sort yourself out and do what? Come back. I don't know about this school. Where I come from, even not full time. We encourage our students in issues, and with some serious issues that you cannot control. Come to school, tell us your problem, and then I don't know what you cannot control on your own. School will advise you write a letter to defer your admission. No second semester couldn't. Once need a letter, school will keep that letter, keep your file for you. More need you to wait. If you are for now, what second semester? You will not lose the admission. Apart from that, any other thing with distraction. Man do more distract. And we can guy. A chair open and we can man nonsense. I believe you. Yes, on your choice, you can say more fine. You can be not where lose your focus. Onye na cheke mono onye uri ze gene nwa do serious no cho nwa anyi mari nya nwa anyi de nwa anyi ma ka oru nya nwa anyi okwo iji maka we lose what you are doing here if you anya acho nwa anyi if you work on yourself first, develop yourself first, after that add upon a line in a select onya yes, select. Anyone build you, I will select. Go and put me anywhere. If you build yourself first as a woman, now you go to select. Now you go to select. So far as you know, the right attitude to life, the right what? Attitude to life. Do the right thing at the right time. Now you go to select now. I don't know what to be. Weekend all right, I think I've lost my voice. I think we'll stop here. We'll continue. Please go through those links I sent. Go through them, study them, make notes from them. Hello? Make notes from them. I will see your notes. Make notes from them. Those things you send it.